Is it possible to avoid medication if you have a diagnosis of rheumatoid arthritis? Hello, this is Dr. Siddharth Tambar, expert in rheumatology and in regenerative medicine. Patients ask when you diagnose them with rheumatoid arthritis is there a treatment? Number 2 or 3 down the list is, do I need to be on medication long term? So there's nuance to this question, and I'll go through with you how you tell the difference. First and foremost is, do you actually have rheumatoid arthritis, or do you have some other diagnosis? For example, do you actually have an underactive thyroid? Do you actually have wear and tear arthritis? Do you actually have fibromyalgia, low vitamin D, a recent infection, and your immune system is temporarily overactive? All conditions that may not require long-term immunosuppressive treatment like you would for rheumatoid arthritis. So make sure you've got the right diagnosis first and foremost. Next, very importantly, is figuring out, do you have moderate to severe rheumatoid arthritis, or do you just have mild rheumatoid arthritis? Huge differences in this case. Number one, how do you tell if you have more severe rheumatoid arthritis? There should be objective signs of active inflammation. That should be in your lab test showing inflammation. On your examination, there should be a lot of swollen and tender joints when you're examined by your rheumatologist. And on your imaging, in particular, diagnostic musculoskeletal ultrasound, there should be signs of active inflammation. In particular, on ultrasound, if you have findings of severely active inflammation, that is associated with a high risk of disease progression within the next 1 year if you do not treat it. So signs of active inflammation are very important here to tell if you have moderate to severe rheumatoid arthritis or whether it's just mild rheumatoid arthritis. And then lastly, also, when did your condition start? Are you presenting to the rheumatologist a year after your symptoms have started and now it's progressive? Or have your symptoms started in the last 4 to 6 weeks and you're at a very early stage of things? That makes a big difference. Once the clock is started, it makes a big difference. Because if you have more significant rheumatoid arthritis and it's been going on for months on end, you don't have as much time before you start to develop damage. MRI studies out there show that within 3 to 6 months of disease onset, people can develop permanent damage from rheumatoid arthritis if their condition is severe. So it makes a difference, time course, degree of severity, as well as having the right diagnosis. So if you have mild rheumatoid arthritis, again, where you don't have severely active inflammation, and you want to avoid medication and you want to try dietary changes, supplements, peptides, I think that's okay. The key, however, is that you reconnect with your rheumatologist within 6 months to make sure your condition is not progressing and that you don't need to definitely start a medication at that point. And number 2 is, if your condition is starting to escalate, make sure you touch base with your physician sooner rather than later. You don't want to miss that window of opportunity for treatment. On the other hand, if you've got moderate to severe rheumatoid arthritis, this is a whole different kettle of fish. You have to be very cautious if you're avoiding medication. In fact, I would say if you're trying conservative route of treatment, you should be rechecking in with your rheumatologist within 3 months to make sure things are not really escalating too fast. And if you're not getting better with conservative management within 3 months, I strongly would recommend that you consider starting appropriate RA treatment at that point. Because again, severity makes a difference. When your condition started makes a difference. All those things make a difference in terms of determining whether you can avoid medications for your RA or not. For the vast majority of patients, yes, you'll likely need to be on medication and likely long-term. The good news is that if managed properly, these treatments can be low risk and dramatically change your future outcome and keep you functioning and living at a very high quality life. But there are those kind of minority exceptions where you may have very mild disease, where you may be able to try to avoid treatment with conservative measures. Just make sure you follow up with your physician. Just make sure that you don't let things get out of control, because once they get out of control, it's hard to get them back under control without anything but medication. Hope that was helpful. If you have any other questions, please let me know. Until we connect again, have a good day and live well. Bye-bye.